Yes, my name's Ellen Calteau. I'm a dietitian now, but I am a food addict first. Hello to the other food addicts in the audience. I know I'm not alone anymore. I thought for a very long time I was alone and was in a lot of isolation, and now I know that my story is quite boring to some people because it's their life. But on that note, when we do come to my story, if you do feel quite emotional at the end, come and get me, come and talk to me. You're really not alone. Or have a look for the people wearing the Liberate badges and have a chat with them as well. They've been there as well. Anywho, so what we're going to look at today. So we're going to go through who's on the team, what the Liberate program is, the study that we've done with Coventry University, and the results, the feedback that we've got, and our next steps. But first of all, who am I? Ellen Calteau. This was me, and I did like the haircut. I liked it a lot. It was Birds of a Feather, the actress from Birds of a Feather. I thought she was great. She was a big lady. She reminded me of me, so I had my hair like her. So I just got bigger and bigger. My dad also, and my sister. We were sent to dietitians, we were sent to consultants. I loved going to them. They said just have low fat. So that was brilliant. So I was going home eating all these low fat yogurts with jam. It was brilliant. Rice pudding with skimmed milk and jam. I thought it was fabulous. I didn't understand what the problem was. And of course, each time we'd go back, we'd have gained more weight. You always came away with that feeling of she's getting it from somewhere. It's not what we're telling you, but she's getting it from somewhere. As things I got older, I got bigger. I was putting on about a stone a year. By the time I left school, I was the biggest and the shortest, as you could tell. I'm not the tallest person, so I didn't carry my weight well. I tried Orlistat. If anyone's tried Orlistat here, anybody know that? That's not great when you want to start dating. That's not nice at all. So my late teens, early 20s, that was not fun. I tried all the commercial weight loss groups. They were fabulous as well. Cook the chips the way they say you can cook them. You can eat as much as you like. So I did. And then paid £5 to find out I'd gained more weight. Oh well, that wasn't for me. I tried the shakes, but of course I'd have to have all 2 of them or 3 of them for breakfast because I couldn't stop after I've had the first one. So it just wasn't going to happen. Things got worse. I got bigger. I put this picture in because anybody that knows me, I'm deadly allergic to cake, but I thought it was amusing. It's egg in cake. I thought it was amusing to pose with a piece of cake. Couldn't eat it, but I posed with this piece of cake. I was just getting bigger and bigger. I was becoming depressed. I tried to find cures on the internet, all these magical teas and capsules. I remember the one type of capsule, don't know where it even came from, still don't know what were in those capsules, but the pressure that they built up behind my eyes caused a lot of problems. So I had to stop that immediately. I became very withdrawn. I started stealing money for food. I started stealing food, rearranging the biscuit tin so you wouldn't know. Right, so take the layer off, or I've had one now, so I'll finish the top layer, then you won't know. Going to the shops in the middle of the night to replace what I'd taken from the house so that nobody would know. Going to my bedroom after eating a meal and then eating crisps with chocolate and crisps with chocolate, just one after the other, because I hadn't heard of salted chocolate. I've not had chocolate for a while now, but I figured that out before they did, that works really, really well, one after the other, until I would fall asleep after crying myself, going, tomorrow will be different, tomorrow will be different. Waking up, and then the next morning, before even opening my eyes, what can I have for breakfast? It's on again, it's on, here we go. What are we going to have for breakfast? No, we can't have breakfast, not today, we're going to be good today. All of these things. I did try keto once. I'd read the Dr. Atkins book. Tried keto, I lost 6 stones. And the healthcare professionals and my friends and family were going, well, you don't want to feel deprived, we don't know how good this is for you, go back on. And of course, once I had that one slice of bread, I'm sitting down at a coffee table with the toaster. I'm not even getting up to the kitchen anymore. It's all off. It's all off now. Put it all back on and more. Got to 20 stone. Wrong way. Got to 20 stone. Very unhappy. I can't keep a relationship. I'm struggling to keep a job. I want to end it all. I know keto will work for me. Low carb will work for me. But I couldn't get back on it. I was triggered. I couldn't get back on it. And then I learned about food addiction. And that was the missing piece for me. When somebody finally said to me, Ellen, just don't have chocolate ever again. It was a relief. It was a relief that I could do that. I could start the grieving process. I could start that now. And I did. Chocolate was the first thing that I put down. It was the hardest thing for me to put down. And when I went to bed realising that the last chocolate I had was 2 fingers of dark chocolate Kit Kat, which to me now thinking about it, dark chocolate, well that's a waste. And you've got wafer. It was wafer taking up space of chocolate there. So, but had I known, I'd have done better. But anyhow, I went to bed and I cried myself to sleep, thinking, well, this is it. I'm going to die now because I can't live without chocolate. That's it. I'm done. But it was a very different feeling the next morning. A very different thought popped through where it actually said, no, Ellen, you're going to die if you keep going this way. So let's just get through today. Recovery wasn't fun. It was hard. The withdrawal wasn't fun. I slept between meals. It was just so hard to manage. I was clock watching. Can I have lunch yet? Is it nap time? No, it's been 10 minutes. But that preoccupation with food was awful. I don't want to go on too much about it, but I have maintained 11 stone weight loss. And maintenance is the important part. So we see a lot of these interventions that they don't tend to keep the weight off for very long. Even in bariatrics, we start to see weight coming back on. But for my story, I've managed to maintain it. And then, of course, I wanted to go and spread this to the world. So I went to my GP, who wasn't David Unwin, and they said, oh, no, we only listen to dietitians. And I thought, well, that's interesting because no one's ever told me about this, and I've seen loads. So I went off and I got my GCSEs, my A-levels, and went to university, became a dietitian. Turns out they don't talk about, or at that point, didn't talk about low carb, and they didn't talk about food addiction, so that explained a lot. Since then, I've gone on to work in the community, wanted to help people with food addiction, and they've said that there's not enough evidence in food addiction for us to warrant a group within the trust I was working for. So with the same sort of determination and stubbornness that I've got, I've said, okay, I'll go get at you. So I managed to start doing some research with Coventry University, and Liberate has been part of my PhD journey, to be able to hopefully help other people in the same situation as me. I do want to say, though, my story led me to obesity. People with food addictions aren't always obese. It is for me. This was my journey. I've worked with plenty of people who I would look at and think, well, there's nothing wrong with you, but they have that same mental preoccupation with food all day long, and it doesn't give up until it's had what it needs, and they keep a healthy body weight. So I do want to mention that. All right then, so let's go on to Liberate. And the team, so you know me now, we've got Dr. Erin Bellamy of IKTR.org, Integrative Ketogenic Research Therapies. She's been helping so much with Liberate and took some of the groups as well. And of course, we've got the lovely Dr. Jen Unwin. And she wrote the book, Fork in the Road. If you haven't read that yet, that is a really good way to start understanding food addiction. And on Friday, all the experts in the field agreed on a consensus on a conference ran by Dr. Jen Unwin and Heidi Yaver at Food Addiction Solutions, and they've agreed, 37 out of 14 actually agreed on a consensus for food addiction, which is a really big move to be able to get this recognised. So big clap for Jen, please. Thank you, Jen. Thank you. So what's Liberate? It's an 8-weekly education sessions that last about 90 minutes. It's run by health coaches and it's all online via Teams, so you can log in anywhere. We have between 12 and 15 people per class, and this is to keep it nice and small. So, for example, it's taken me years, and it's because of Jen that I can tell you my story now. But I would never tell you guys that I've ate food out of the bin. I could never do that. So we keep it nice and small because some people have got a lot of shame behind this. And we keep it small and intimate so they're able to share these kinds of experiences if they need to. We also offer a weekly support group that will be a part of the course for 1 year, but you're welcome to keep coming back as well. In addiction services, the support is the main part. It's the key part that we need to keep ourselves in recovery. We've got a comprehensive workbook that people work through daily. This is all part of the therapy in helping the prefrontal cortex. We take a positive psychology approach, and we advocate a low carbohydrate lifestyle. But if people don't want to go with a low carbohydrate lifestyle, we work with them just to help them get through their abstinence of whatever foods are causing them problems. We also build social support networks because we know that addiction equals isolation. So we want to bring them out of isolation so they're not alone anymore. So about the study, it's a mixed methods feasibility study. Our inclusion criteria are those over 18, a BMI of 20 or above, able to read and speak English, had access to a computer and a microphone. They were excluded in the study if they're having a current episode of anorexia nervosa, and they were referred to eating disorders team. They were excluded from the study if they were planning to become pregnant or about to undertake bariatric surgery within the next 6 months, but they weren't excluded from the course. They were welcome to stay on, but we didn't collect their data because of the BMI results. So our aim was to recruit 135 people, and thank you, Olivia. Because of Olivia, we managed to get it out into the community via social media. Our primary outcome was feasibility, acceptability, and ethnographic assessment. I'm still going through these. I also should bear in mind, this data only came available about 2 weeks ago, so I'm just presenting what we've got so far. And it's our secondary outcomes that we'll be looking at today. So the addictive eating behaviours of the Yale Food Addiction Scale 2.0, craved binge eating scale, and When Webb's the Wellbeing from Warwick and Edinburgh Mental Wellbeing Scale. So we aim to recruit 135 people. We managed to recruit 105. Out of those 105, 86 actually started. Out of those 86, we had the definition of completers being those that had attended 4 or more sessions, and that totaled to 68. Some of the dropout reasons are here on the screen here. Other health priorities, work, exams, things like that, meant that they weren't able to continue with Liberate at that point. But they're always welcome back. All right, so let's go through some demographics. You can barely see that, sorry. So the majority of the people that attended Liberate were women. This didn't surprise us. Although Liberate isn't a weight loss intervention, but it does come as a side effect, we knew that that's what people would be thinking, and the majority, there is a big proportion of people who are obese and also suffer from food addiction. So it's not uncommon for weight loss interventions to be predominantly women. Does this mean that food addiction doesn't affect men? No, it doesn't mean that at all. It may be, though, when we look at the addictions literature, it seems to be very male-dominant in drug use and alcohol use, and it may be that they're in those rooms for now, but I can tell you that the people I've worked with, the men that I've worked with who have put down alcohol or drugs first, often say to me they'd rather do that again than putting down the food, and they're finding it even more difficult. So I would like to hopefully see at some point a little men's group starting so that men can move forward or come forward and say they need help. The age was average 35 to 45 years. What does this mean? It could mean for now that the younger age group are feeling invincible. Doesn't matter, it'll be okay for now. I'll just keep eating these things. Or maybe it's not causing enough of a problem to start looking at things. It could be that they're young parents. They've got work and their career starting, so it's not a priority to them. And for the older age groups, perhaps they're more accepting of the condition and just not aware that they could even get some help, because we did find that as well. Our demographics for ethnicity was predominantly white. Could this be because in the minority groups, the word addiction is quite a stigma attached to it? So is there a learning that we could get from there? That's something that we need to look into as well. Education, this one's quite important for your healthcare professionals out there. So 3/4 of our group were university educated. So when you have a patient coming into your clinic and they say to you, look, I'm not stupid, I know what I can do, I know what I should be doing, believe them, they're not stupid. They can't do it, they've got problems that they need extra support with that they're not going to find in a commercial weight loss group if that's where you're thinking of sending them. So do try to respond to them with some kindness and compassion, and understanding that, and helping them to understand that addiction is a disease of the brain and they need extra support. And there were, most people were employed as well. BMI, over 3/4 were overweight or above, which matches out, again, the literature that for weight loss interventions, although Liberate isn't a weight loss intervention, is a side effect of it though. This one was quite surprising, that 2/3 of them, of people, didn't know that there was help for food addiction. They knew food addiction existed, but they didn't know they could get help for it. So there's a lot of people kind of walking around believing everything that's there. They've got no willpower, it's their fault, and don't even know that there could be help for them. So that's something to bear in mind as well. So the average Liberate participants, middle-aged, employed, highly educated, white female, living with overweight or obesity, and unaware of help for ultra-processed food addiction. That's something to bring into your clinic. So let's have a look at our results. All right then. So 79% completion rate. So that's that definition that I said, 4 sessions or above that people attended. This was quite good because the average diabetes prevention program has a 34% attendance rate. So people wanted to keep coming back to Liberate. So that was good. That was good to see. We also had, we used the YFAST 2.0 for measuring our food addiction symptoms. And we saw a 46% reduction of food addiction symptoms in our participants. So to give you an idea of what that means in our numbers, we had 60 people in the severe category when they first came into Liberate, and when we finished, there was 58 of them that had no food addiction, from right down, absolutely right down, which we're really, really pleased with. I hope that continues. We'll be following up again in 6 months. Then we also wanted to make sure that we weren't causing any harm, because there's this notion that if you take away carbohydrates, you may exacerbate any eating disorders. Anecdotally, with clinicians and the people in the area, we don't see that in clinic. People tell us how they feel a lot better, and that their binge eating symptoms have seemed to have reduced. So we wanted to make sure this, and we try and get some data for that. And we did find that 44% of our participants had a reduction in binge eating symptoms. To give you an idea of that, when people first came in, they had 73 of them had moderate to severe binge eating symptoms, and at the end, 50 of them had minimal binge eating symptoms. So we do see a reduction in there, and that warrants further research just in that area alone. We would definitely like to know more about that. And then we measured health, well-being through WEMWebs. And for a clinically meaningful change in a public health population, we would like to see an increase of 3 points in the WEMWebs score. I'm very happy to say we found 6. We had 6. So that is good as well. I'd like a clap just for this moment, just for this bit. Thanks, guys. Thank you. I'm just happy all the animations worked as well. All right, so what have they said about us? Oh, that's quite faint as well. So Liberate has given me my life back. I can totally relate to that. That sort of stuff makes me want to keep getting up in the morning, keep doing this job. The Liberate tools have been very, very helpful in my recovery from food addiction. I can walk around a shop without being triggered. Now imagine you wouldn't send an alcoholic to keep going to the pub all the time, but we've got to go shopping all the time. All these pretty rustling packets and the bakery smells, there's queues everywhere for us. They can walk around the shop and not feel triggered. So that's lovely to hear. I can focus on my family, friends and work better now and not think about food all the time. I really enjoyed the science. It was all well explained and I feel I understand myself better now. I have life in between meals and peace whilst eating. The group support was the most valuable tool for me. I now know I'm not alone. My favourite part was learning about what was happening in the brain, and I especially enjoyed the science. There's some of the feedback we've had. I've learnt so much in the last 6 weeks about my addiction myself. The sharing sessions have been helpful. WhatsApp group has been brilliant support too. Thank you so much for helping me understand this illness and giving me the hope to recover. Another person wrote into us to let us know that they'd lost 12 pounds in weight, 34 centimetres across their body, their blood pressure came down and their blood sugars came down as well. All right, how am I doing for time, Sam? Excellent. All right then, I want to introduce you to somebody very important to me. But before we do, can I have a big clap for the participants? Because without them, this wouldn't have happened. They're fabulous. Thank you. It takes a lot to write into somebody and say, the foods that I've been eating all my life that are totally socially acceptable, I can't manage them, and I keep going down in the middle of the night and pinching the kids' advent calendar, and I've brought 3 this year. It takes a lot of courage to do that, so I'm so proud of them. Anyhow, one of the things that we do in Liberate, just to give you healthcare professionals an idea, if you're a non-addict, what's going on up here, whilst Ellen sounds like she's all coherent, this is what's going on upstairs. So we ask our participants to put an identity to whatever it is that's telling them, that's driving them to the fridge themselves. Some courses put, say, like the angel and the devil, or got Bitten's red dog. We like people to use that creativity centre themselves and come up with it themselves. But before I go on to everybody else's, I want you to introduce you to mine. So this is our Kev. This is Kevin, who finds things very unfair. It's very unfair, Ellen, that you can't eat chocolate. It's very unfair that you can't eat biscuits. But Kevin has very much grown in with my life now, and we get along quite amicably. And this is the sort of flow that we see as we work with people. It starts off with, I'm quite, at the very beginning of recovery, I was really quite angry at Kevin. He's ruined my body. I've got saggy skin everywhere and stretch marks, and I can't move without clapping. It's just horrible. He's ruined it for me. And now I can't even have chocolate to make myself feel better. So I'm angry at him. And it's that anger that gets me through withdrawal. It's that bit that is, I'm going to show him. That's the white knuckling. I'm going to get through that withdrawal now. And I hit that ketosis part. Everything starts feeling really good. And now I'm frightened. He could pop up at any time. I'll steer clear of that. I'm not going out anymore. I won't go to restaurants. Oh, no, I don't like that. I can't go to family occasions because he could pop up at any time. Over time, you see that he doesn't pop up. And actually, you have a bit of an acceptance toward Kevin and a bit of compassion, actually, when I start to think back at the people that bullied me at school and people that were unkind to me at work and I overshot for promotions because of my obesity. It was him that reminded me, the pizza will make you feel better. It did last time. So he got me through that. But over the years, I've been able to converse with Kevin and go, well, actually, it did help us. It helped us massively, but it also made us a lot bigger, and it made us very unhappy and miserable, and it meant we didn't stop for months. So maybe let's try it a different way for now. And now our Kev goes, all right then, let's give it a go. And we can get past it. It takes time, but it does work. So we asked the participants to do this themselves. And one come up with it any way they wanted to, and one chap wrote the most beautiful poem, and sadly it hasn't printed off very well for me here, so let's see. So this is what he's written. It's always talking to me, but never says a word. It keeps on interrupting to make sure that it's heard. It goes silently behind me and appears with the fridge light in the morning, noon and evening, in the middle of the night. It's just the same age I am. We share the same birthday. It's shades of grey in colour, though not grey in that way. It sneaks right upon me with big cat's quiet stealth. It selects its prey and foodstuff with disregard for my health. To share more of my addiction could leave me feeling hollow. To learn to live with it again would help me manage shadow. That's what it's like. And we did have a very creative bunch, and this is what people came up with. This is a dust bunny. This lady made this herself. The way she sees her Kevin is dust. And she tries to bat it away as much as she can, and she gets a bit of reprieve. But what happens with dust? It all settles and consumes again. It comes back. So she bats it away and fights it. Now she lives with Dust Bunny, and she gets on with it, and we carries on using the tools. Other people, or somebody else thought it was Gollum. I must have that precious. Tantrum. Oh, I can relate to tantrum. Yeah, a couple of them. A ditch that you're just going to fall into at some point. It's going to get you. You're going to fall into that ditch. It's a monster that just makes you want to eat everything, and you're frightened unless you don't. Tasmanian devil, I can totally relate to that, just whizzing around anything I can get my hands on. I don't know, what's his lady's name? Doyle, is it? I've forgotten the lady's name. Just go on, one more. This is so much more relatable if they can come up with it themselves. The snake that hypnotises you into it, tempts you. The Blob, Mr. Blob, it's one of the participants just saw it as Mr. Blob, and now takes Mr. Blob to the shops with her and says, yeah, we'll just leave that oil for now. Next time, Mr. Blob, we will. A bear that's just going to pounce on you. A cloud that covers you all the time, feeling sad, feeling oppressed. I must have it. Another tantrum, that comes up a lot. The fridge, the fear of the fridge. And the Cookie Monster. Often these, what they come up with, they don't speak kindly. They're cunning. They're convincing. They're fast. They come in and they like that before you know it. I can't have this food thing in my house because I'll eat it. I can't put it in the bin because I'll take it out and I'll eat it. I know what I'll do. I'll eat it. Be out of the house then. And it's done. It's gone. Hold on. Where was the sense in that? It was so fast. They can be all-consuming, but they never tend to speak nicely to us. It's always shameful and pushing you to feel bad, and then you'll feel better if you have that food bit. Almost done, Sam. Almost done. Okay, so what we're doing next, our next steps, is to take the feedback and apply them. So originally it was 6 weeks. We've extended it to 8 weeks now. We've improved the workbook and we'll be giving access to slides in a pre-recorded version. I need your help because I am naff at social media. Please help me shout about this in blogs and podcasts. I'm willing to do them now. And so we can run the course again. We're going to run it again in June, a week commencing the 17th of June. We're going to be offering a GP surgery 33 spaces. So if you're interested with your GP surgery, please email liberate@phcuk.org. And to make sure that we can help as many people as we can, we're offering 30 spaces to the general public as well. It will be £195 for the education and the year support. If you find, though, that Liberate isn't for you, those dates aren't convenient to you, you still want help, we've got Dr. Erin, who offers one-to-one support. We've got Coombe Grove down by Bristol, who does addiction retreats. There's online support from other people also working in the field. We've got Sweet Sobriety, Sugar, Global X. And then we've got the peer-to-peer support groups as well, such as Overeaters Anonymous and Food Addiction Anonymous. So if you have any questions, they have a stand as well today here as well. So there is support there. Don't let Kevin go, well, you can't do the 17th, so that's it for a year. Don't let Kevin do that. All right. And we have a website now. Thank you to Lisa and Amy. So you can go over to our website, have a look. That's where you can ask any questions. It's where you can sign up for the course, sign up for our newsletter. And with that, I think if we have time for questions, or you can catch me in the break. Thank you very much for listening.